Hello, my name is Elaine Justice. I am your nurse navigator. We're going to talk today about your pre-op process and our Oklahoma Joint Reconstruction Institute pre-op process for total hips and total knees. Today we're going to talk about your pre-op process, preparing for your procedure, optimization, what to expect from us, and what to expect during your hospital stay. We'll talk about physical therapy and pain management, how to care for yourself at home, the role of your coach, which is your family and friends, discharge planning, and some of the things you can do to help yourself before and after surgery. It takes all of us, and you are part of the team. Once you're scheduled for surgery, there are some important milestones that are going to happen between surgery scheduling and surgery. First of all, let's talk about exercise. I know most people say they can't exercise because it hurts too much, it's too difficult, it may cause more damage. Exercise prehab is not necessarily high impact exercising. It's strengthening and toning. It could be low impact, but most importantly, you're just getting your body ready for a major surgery. This can just be at-home stuff. Nutrition is critically important for orthopedic surgeries. Remember to decrease caffeine and alcohol intake and increase fluid, water, lean proteins, whole grains, and vegetables. These are rich in all of the vitamins and minerals that you need before surgery and after surgery. It's important to use natural whole foods to get most of your vitamins and minerals. Vitamin C, vitamin D, calcium, and iron are important for bone health. The best place to get these is in your food. Most people don't get enough of these in your dietary daily intake, so supplements are recommended. A good multivitamin is a good place to start. Your health before surgery and after are important. Before surgery, optimizing you helps you get ready for a major surgery. After surgery, your health is going to help you recover faster. Some of your modifiable risk factors that we need to have you start working on before surgery include your BMI. It needs to be below 40. Your A1C needs to be below 7.5. Nutrition, as I said before, is important. Malnutrition is one of the top reasons for a surgery to be delayed or rescheduled. Nicotine. There's a lot of nicotine cessation programs out there. We're happy to help you with that. Remember that you don't want your surgery rescheduled because of any of these modifiable risk factors. Please give me a call. I'm happy to help you with these, and we can talk more about how to work to fix these risk factors. While preparing for your surgery, please read your patient handbook. This book is custom built just for you by Dr. Jacob and our staff. Each book is specific to total knee patients, partial knee patients, or total hip patients, depending on the surgery you're having. There is a tab for you to take notes, write questions, bring it with you to all of your appointments and to the hospital. It's one place where you can keep all of your information. Pre-admission testing department is the hospital's lab department. This is where you're going to go for your lab, CT, EKG, chest x-ray, anything that's needed for anesthesia clearance. Ideally, it's great to go 2 to 3 weeks before surgery. Pre-admission testing department will contact you and set your appointment. In the front of your patient handbook is all of their patient forms. Please fill these out ahead of time. It will save you time later. If you have a complex medical history, you may need more than one appointment, and you may need an additional appointment with any of your specialists, cardiologist, pulmonologist, to clear you for surgery to make sure that you're safe to have surgery. While you're preparing for your surgery, let's also prepare your home. Pretend like you've already had surgery and walk around your house looking for trip hazards. Trip hazards can be pets, kids toys. They can be throw rugs, coffee tables, furniture that's in your clear path. Make sure you have a clear and easily accessible path from your living room to your kitchen, your bathroom, and your bedroom. Make your home recovery center. Set up where you're going to be during the day, and then set up where you're going to sleep at night. In your bathroom, please make sure you have everything you need before you have surgery. A new toothbrush is important. Paper towels instead of cloth towels, because you don't want to reuse towels. Paper cups instead of a cup that sits on your bathroom counter are going to be cleaner and have less potential for germs. Stock up on your household items. Pretend like you're going to be home for a couple of weeks and stock up for everything you need for a staycation for approximately 2 weeks. Place all of your frequently used items at arm's length. If it's way up top and you have to tiptoe to reach it, please bring it down to counter level. If it's something that you have to squat down and pick up, please bring that up to counter level so that you have everything you need on a daily basis easily accessible to you. Meal prep. I always talk about meal prep. It doesn't have to be elaborate. It doesn't have to be expensive. Meal prep is just chopping up vegetables, protein, anything that you can prepare ahead of time that is going to decrease the preparation after surgery for you or for your family or friends. When you're setting up your recovery center at home, this is going to be all of your daily use items. Where is your cell phone charger? Where do you charge it during the day? Your reading material, your remote control, all of the things that you're going to be sitting there using and relaxing during the day. And make sure that you have a clear path to do some exercises and a clear path and a space for your PT to come over to your house and help you do your home health PT. A lot of people ask about equipment for home. Now is a good time to call your insurance company, ask them what DMEs, that's durable medical equipment, that they cover on your specific plans. Some of the things you may need at home are ice packs or gel packs. Your accessory kit has a grabber, a long-handled shoe horn, a sock assist, a gripper, and a long-handled sponge. Elevated toilet seats. Now is a good time to think about how high or how low your toilet seat is. The higher your toilet seat is, the easier it is to get onto and off of. If it's not high enough now, you might want to think about an elevated toilet seat. If you're going to do an elevated toilet seat, get the ones with arms. That way you can use some of your upper body to help you on and off of the toilet, as opposed to trying to use your walker to get on and off. Ice machine is a great idea. It's a lot more therapeutically cold for longer time than ice packs or gel packs. The nature of having a total joint procedure is going to create and generate heat. That heat heats up ice packs and gel packs much faster than if you just had a sprain or a strain. So a ice machine or cryotherapy keeps that temperature therapeutically cold enough for hours as opposed to minutes. If you don't have a shower bench built into your shower, you might want to think of having one in there temporarily. Once you get to take a shower and you have hot water running on you, that hot water combined with pain medication can sometimes make you very dizzy. A shower is not a great place to fall, so please think of that ahead of time and have someplace safe to sit. Communication before surgery and after is important. Before surgery will help you optimize. After surgery, communication and an open line of communication is important to help you recover. Some of the information you'll hear from our office includes from your PA, from our surgery scheduler, from me, your nurse navigator, and of course from Dr. Jacob. We have a couple of apps that are going to help you prepare and recover. Recovery Coach is one, Motion Sense is the other. If you'll also go to our website, drpauljacob.com, we have a lot of patient information under the Patient Information tab. The communication you'll hear from the hospital includes the pre-admission testing department that I told you about. It will also include the hospital's billing department. They will go over co-pays and payment options. You'll also hear from the hospital's surgery department. They will call you the day before surgery and ask you to confirm your surgery. They will ask you to stop eating and drinking at a certain time. They will tell you what time to be at the hospital, and they'll tell you what time your surgery will start. They only do this the day before surgery. If your surgery is on a Monday, they will call you on a Friday. If you do not hear from the surgery department by 4 o'clock the day before your surgery, please give us a call or call the hospital. They will transfer you to the surgery department and they will let you know what time your surgery will start. The pre-admission testing department will give you a special soap to use right before your surgery. Shower exactly the way they tell you to shower. Please don't shower with this soap above your neck. Don't put it in your hair. Don't wash your face with it. When you start this shower, please make sure you use a clean towel each time. Make sure that you pat dry. You don't want to rub your skin. Please make sure you do not use any lotions or powders. And please make sure to put on clean pajamas, nightgowns, whatever you wear at night to sleep. I also think it's a good idea the day before surgery, put clean, fresh sheets on your bed. That way your bed is ready for you when you get home after surgery. The day before surgery is time to pack light. Please bring your assistive devices, your glasses, hearing aids, dentures, CPAP machine. If you have an advance directive, please bring one for the hospital to make a copy. Your personal and comfort items, your hairbrush, your toothbrush, if you have a pillow you prefer, please bring that. If you already have a walker, you can bring that one if you would like. Your clothes and shoes need to be loose fitting, need to be easy slip-ons, but your shoes make sure that they are not flip-flops or sandals. Your identification and your insurance and any co-payments that you have discussed, and your personal representative or visitors. This day and age, the visiting policies change on a daily basis. The hospital's surgery department will let you know the day they call what the current status of visitors is. On your day of surgery, you'll check in. Registration will give you your ID band and get you all set. Your pre-op nurse will come and take you back to the pre-op department. They will start your IV, get you in a gown. Anesthesia will come and talk to you. Dr. Jacob will come and see you. You and Dr. Jacob will both initial your surgery site. Your surgery nurse will come and take you back to surgery. This usually lasts for about 1 to 3 hours. After surgery, Dr. Jacob will go out and talk to your family. Your anesthesia provider will take you to recovery. You're usually in recovery for approximately 1 to 2 hours. While there, they watch your vital signs, make sure you wake up easy, you're not nauseated. They'll give you some ice chips or some sips of clear liquid. After you meet recovery discharge criteria, you'll go back to your room. Once in your room, please expect to be up and at least walking to the bathroom within 2 to 4 hours after getting to your room. Once you get to your room, we have a rapid recovery program that we will help you get up and walk immediately after surgery. Please remember to never get up by yourself for at least the first 24 hours after surgery. And because we're able to get you up so quickly, we don't use Foley catheters unless they're medically indicated. Remember to get up for meals. It's better to eat sitting up in your chair as opposed to in a bed if you can. Our team of physical therapists and nurse aides will help set up your equipment and help you learn how to use it. And the rest of the day, just rest. You've had a big surgery. Let's talk pain management. When I say pain management, I don't mean pain-free. Your goal for managing your pain is to be able to manage your pain so that you can eat, sleep, drink, and move into your PT undisturbed or uninterrupted by the pain. Work with your medical team to set a goal. Before surgery, if your pain scale is not a 0 on the scale of 0 to 10, it won't be afterwards. Report pain promptly. It's easier to manage pain than it is to try to catch up and get control of pain. Tell us about things that have relieved your pain in the past. Tell us about things that cause more issues. If all pain medication makes you nauseated, tell your team that. We'll make sure that we give you something before we give you pain medication to stop that side effect after. Be open to other options. Ice and elevation are great pain relievers. If you can control the swelling, that also helps with controlling the pain. Remember, you're wanting to manage the pain. This is not the time to see how tough you are. Increasing your pain decreases your ability to do your rehab, so let's manage it. We use a pain scale of 0 is no pain, 10 is the worst imaginable pain. Think of this scale in your daily life and as you're recovering. So 0 to 1 is pain-free. You probably weren't there before surgery. Please don't expect to be there after surgery. 2 to 3, you're able to do everything we're asking you to do. You're able to do your PT, you're able to get up and walk, you're able to sit up and eat, you're able to converse without difficulty. 4, 5, you may have to stop for a second and take a deep breath, but you're still able to do all of the things that we're asking you to do, and you're able to communicate and participate in your recovery. 6, 7, now you're having a little more difficulty. You may have to cut things short. If you're doing PT, you might not be able to do your full PT. If you're having lunch, breakfast, dinner, whatever, and you're starting to get nauseated because the pain is hurting, this is where you medicate, okay? 8, 9, 10, you're unable to do the things that we're asking you to do. You're unable to eat or drink because you're hurting so bad. This is where we're playing catch up. We should have already medicated you. Once you go home, it's important to use the same scale so that everyone who's helping you or your caregivers or your coaches are all talking the same language. 6 and 7, this is where you medicate. 8, 9, 10, this is where you play catch up. Let's try not to get there. You actually end up taking more pain medication when you're playing catch up and you're taking the max amount of pain medication than if you'd manage it where it first starts to interrupt your recovery. Okay? 8, 9, 10, your blood pressure goes up, your heart rate goes up, your oxygen demand goes up. Your body is in a stress response. It slows healing and it slows your recovery. Your goal to managing your pain is to not get to that 8, 9, 10 level. So when I say manage pain, I truly mean manage it where it interrupts your recovery, not trying to play catch up after you can't do your recovery. We have a common term called nerve blocks. Let's discuss and separate. 2 months before surgery, a month before surgery, you're thinking about a genicular nerve ablation. This is the time to think about the genicular nerve ablation. This nerve block blocks the sensation to the nerves around your knee. This is for knee patients only. Needs to be done before surgery, and it lasts for several weeks to months after surgery. An interarticular block is a block that Dr. Jacob does in surgery. He injects a numbing medication around the joint before he closes. This lasts for several hours. This is part of our rapid recovery program that helps you get up and move faster because you are more comfortable to get up and move. Abductor canal blocks and femoral blocks are for total knee patients. This is a procedure that your anesthesiologist will do before surgery. It numbs your extremity, but you don't lose function to that extremity. It lasts for approximately 8 to 24 hours or so. The important thing to remember about these blocks is that they wear off going up your leg. So when that block starts wearing off, you'll be able to feel your toes. Then you'll be able to start feeling your calf. This is the time, if you haven't taken pain medication, that you need to at least take one pain pill, because you want to have that pain medication in your system before that block wears off above your knee. Because then at that point, those nerves are awake and they could be pretty angry. Earlier I mentioned cryotherapy. This is a motorized pump that pumps ice water from a chest through a tube to a pad, goes on either your hip or your knee. This decreases the pain, it numbs the skin, and it can decrease the swelling and inflammation in the joint. The benefits of cryotherapy over ice or gel packs is the consistency of the therapeutic cold temperature. As I said earlier, ice packs and gel packs, depending on their size, only stay therapeutically cold enough for approximately 10 to 15 minutes. And then the heat from that joint starts heating up those ice packs and gel packs to where they're actually warm and returning heat back to that joint. Cryotherapy is usually not covered by most insurances, but Dr. Jacob, our PAs, all of the PTs will tell you that they are far superior at controlling swelling, numbing the skin, and decreasing the pain than the ice or the gel packs. As you recuperate, these are some of the equipment that you will see from the hospital. These are considered medical necessities, so the hospital will provide these for you. The first one for knee patients is the continuous passive motion machine. This will go home with you. When you come back to the office for your 3-week follow-up appointment, you can bring it back, or the company will arrange to come get it for you. TED hose are compression hose. They go on both legs, not just your operative leg. These are important to decrease your potentials for deep vein thrombosis, blood clots, and they need to be worn 23 hours a day for the first 3 weeks. Incentive spirometer is equally important. This is a breathing exercise machine that helps you exercise your lungs and decrease your potential for pneumonia. As you take pain medication, especially narcotics, you increase your risk of pneumonia because you decrease your respiratory effort and rate. This machine is on you. It goes home with you. It is important for you. Every hour on the hour that you are awake and you're at home, pick this thing up. It needs to be in your recovery center at home. Just take 10 really big breaths. In slow, hold for a second, take the machine, take it out of your mouth, and blow out. Every hour on the hour that you're awake. There's a really good diagram in your patient handbook on how to use this. Your walker, everyone will go home with a walker, not a cane, not crutches, for the first 2 or 3 weeks. Depending on your physical abilities and your physical therapy, you will eventually graduate to a cane, but the first week or 2, maybe 3, your walker is very important. It's not meant for weight bearing, it's meant for balance and stabilizing you. Total hip patients can go home with a wedge. It's just a foam pillow that goes between your knees while you sleep. While you're awake, you are very aware of not crossing your legs. Once you're asleep, you may not remember that. So this just helps you to remember not to cross your legs and break hip precautions. If you have any questions on any of this equipment, please give me a call at the office. The next morning is your typical day of discharge. It's a very busy morning. You will see Dr. Jacob first. If you meet criteria for discharge, he will write your discharge orders. You will see the hospitalist next. If you medically meet discharge criteria, your hospitalist will write discharge. Lastly, you will see your physical therapist. Your physical therapist will assess your gait progress, how you walk. And if you meet their criteria, they will also agree and write notes that you are clear for discharge. You get a lot of information this day. All of it is in writing. Please refer to any of your discharge instructions and have your family do the same. In this discharge instruction is your equipment education, your home exercise program specific for you from your physical therapist, any condition-specific aftercare that the hospitalist, the PT, or Dr. Jacob thinks is important for you for being discharged safely will also be in this packet. All of your safety education is in there. All of your important phone numbers for aftercare is also in there. Any recommendations Dr. Jacob or the hospitalist will go over with you and your family members before you're discharged. Discharge planning starts before you have surgery. This is an important conversation that you need to have with your insurance provider and with your family. Please talk to me if you are having any doubts about what to do after surgery. Please give me a call if you're contemplating rehab or skilled nursing, or you're going to have to travel to a different location after surgery for your recovery period. You do need help. Some people who are younger or are more fit are able to go home by themselves. Most of the time you will need a little bit of help, at least for a week after surgery. So it's important to start planning that before surgery. The hospital has wonderful case managers. These are nurses who are experienced in case managing and placement. They will set up your home health. They will make recommendations for subacute care if that's needed. Nothing is set in stone for you to go home until you're safe to go home. But it's important to start planning this before surgery. We cannot, according to most insurance companies, pre-approve you for inpatient rehab or a skilled nursing facility. This has to be done after surgery. Because of an elective surgery, most of the time it is going to be considered that you will go home after this surgery. If this is not the case, please give me a call. I have a lot of information and a lot of resources that can help you. Infection control after joint replacement is very important. Joint infections remain a serious complication after arthroplasty. There are several things that can contribute to a joint infection. History of frequent UTIs, poorly controlled A1C, delayed wound healing, wounds on the operative leg, and pain medication for chronic pain patients increases your risk of joint infection after surgery. We utilize the latest techniques and methods and research to prevent and decrease surgical site infection, but it's important for you to remember that there is no substitution for good hand washing habits. Remember to have your friends and family wash their hands before they come into your room or they help you with something. Please don't share or reuse towels, washcloths, glasses, utensils, dishes. All of those things need to be cleaned and sanitized before you reuse them. Please report to Dr. Jacob immediately if you have any signs or symptoms of an infection. They are in your post-op discharge instructions. Please speak up if something doesn't look right, sound right, or feel right. You are an active participant in this team. You know your body better than we know your body. You know how things make you react better than we do. It's important to speak up, ask questions. If you don't understand something, please say, I don't understand. Can you explain it a different way? We're not going to be upset. We're going to take time to answer everything you need to make you comfortable and knowledgeable and an active participant in your healthcare team. Another potential complication after a total joint procedure is blood clots. We do several things to manage and decrease that risk for blood clots, DVTs. Mobility is your number one. Build up to increasing your distance. Build up to increasing how often you get up and move. The more you move, the less likely you are to have a blood clot. Medication management is another part of this protocol. You will go home with some type of antiplatelet according to your medical history and your previous medications. Compression hose, I know everyone hates them, but they could save your life. They are difficult to put on. We will help you and we will teach you. They have to be worn for 23 hours a day for your first 3 weeks. The more you're able to get up and move, the less time you're going to have to wear compression hose. If that's a great motivator, that's good. Once you come to your 3-week follow-up appointment with our PA, they will assess your PT evaluations and they will discuss with you if you can take your compression hose off. Once you take the compression hose off, please don't throw them away. Please wash them and keep them for any time you travel. These are a good thing to wear while traveling and it will make your travel more comfortable. Here are some risk factors for DVTs, blood clots, or PEs. If you've had previous blood clots or PEs, it increases your risk. Medications can increase your risk, especially hormone replacement. A family history of blood clots, a previous MI, heart attack, or congestive heart failure can also affect your risk factors for DVT. These are not an all-inclusive list, but these are some of the important risk factors to keep in mind before you have surgery and to help you decrease the risk after surgery. A poor appetite after surgery is pretty common. After surgery, it's not about are you hungry, it's about you have to put the building blocks back in the body to help it heal. You have to give your body energy to do the work we're asking you to do. Here are some good practice points to help you after surgery and even before surgery. So if you need to eat smaller meals, make sure that what you're eating is good for your body. So instead of eating chips and dip, maybe eat crackers, whole wheat crackers, and cheese. Eat light meals throughout the day to help you keep your energy up and also provide the building blocks to help you recover from your surgery. In worst case scenario, if you just feel like you can't eat anything, try a protein shake. Please read the label on protein shakes. Make sure they're not full of sugar. Make sure they are high in protein, at least 20 grams of protein, and make sure they're low in sugars, and that will say total carbohydrates. You want total carbohydrates to be no more than 5 grams, and you want your protein to be at least 20 grams. If you need help deciding which ones that you can drink and which ones taste good so that you will drink them, please give me a call. I'm happy to help you with that. Good nutrition is important all of the time, but good nutrition is critically important after any type of surgery, especially orthopedic surgery. Bones are made of minerals, calcium, iron, magnesium, made of vitamins that help build those building blocks. You need to make sure you're getting all of that in your body so that you can help that bone heal and strengthen. Now, the issue with a high protein diet and the pain medications that you may be taking is constipation. Nobody likes to talk about this but nurses, but this is important. Most of your pain medication is going to cause constipation. Your decreased mobility is going to contribute to that. Please make sure you are hydrating. That means drinking water, not tea or coffee or soda. And make sure that you're getting enough fiber, vegetables. If you don't like vegetables, maybe a fiber supplement. But make sure that you're physically active, you're hydrating well, and that you're getting enough fiber in, that you're moving every 2 to 3 days. If you have too loose of a stool, you may need to back off of your stool softeners and your laxatives that we prescribe. Make it work for you, not against you. If you're constipated, you're not going to want to put in the work that we're going to ask you to do. There are a lot of diet resources out there on the web to help you find some new and exciting, appetizing recipes. There are different places around town and around the metro now that offer healthy, homemade, pre-cooked, pre-packaged recipes and meals. It's a good time to try those. Please avoid using a lot of TV dinners. Most of those are very, very high in sodium and a lot of preservatives. None of that is good for you. If you need more information on diet resources, please go to our website. Under the Patient Education tab, there is a Nutrition tab that has a lot of great resources for you. Again, if you need more or you have questions, please give me a call. Thank you for taking the time to watch this video. Below is my information. Please utilize your Nurse Navigator. Please utilize your resources in your patient handbook and on our website. If you have more questions, please give me a call or email me. If your family or friends have questions, they're free to call me also. We want you to have a very good experience, and we want you to be an active participant in your healthcare decisions and in your total joint recovery program.